Hey, this is Doug Field along with my co-host Ron Bachman, and welcome back to this segment of Healthcare Consumerism Radio. And joining us to lead a discussion about healthcare payments is Joan Christensen, VP of Health Services with First Data. Joan, good morning.
Good morning.
You coming to us from Omaha today?
Omaha, Nebraska, yes.
Great. Go Cornhuskers, right?
Well, they're not. I don't know how well they're going to do this year. We'll have to see.
Hey, well, listen, we'll get into healthcare payments in a minute. I'm a Buckeye, so I'm pretty disappointed already. So, well, Joan, nice to have you on the program. Good to talk to you.
Thank you. Nice to be here.
Okay. Give our audience a little background on First Data, specifically the healthcare segment that you oversee.
Sure, absolutely. And thank you for this opportunity to be able to speak to you and your listeners about what First Data does. So, First Data may be a name that people are unfamiliar with, but we are a global technology leader in the payments industry. So really what this means is we provide secure and innovative technologies and services for our 6 million merchants, 8,000 FIs, and 800 million consumers with accounts on our system. Okay. So from a healthcare, what does that mean from a healthcare perspective? Really what it means is we have ability to provide solutions for hundreds of thousands of providers in the nation, thousands of hospital systems today, as well as millions of consumers and moving money. So basically, payments are in our DNA.
Yeah. Talk to us a little bit about, specifically what you do in the healthcare payment space, because I think it's probably one of the silent solutions that goes to work, and a lot of people don't pay attention to it, but it's very, very important, and it's changing too. So talk to us a little bit about specifically what you do in the healthcare sector.
Sure. So, yeah, there's the healthcare payments, right, is such a vast difference from any other kind of payments that occur anywhere else, right? So medical payments, you walk in and receive a service or a product, and you may not know for 30 days later how much is due for that service or product. So it's a difficult process. There are lots of different stakeholders in that solution set. So First Data works with providers in giving them solutions for their front office, their back office collection services, ability to determine whether a patient is able to pay, as well as from a consumer perspective, tools that help them build their health and wellness, and whether it's a health savings account processing, or whether it is a wellness incentive prepaid debit card that incents employees from to do make healthy choices in that process.
Joan, Ron Bachman here. You've listed out your company, pioneered a multi-purpose healthcare card that provides access to HSAs, HRAs, and FSAs. One of the things I'm most interested in is the other funding sources that you mentioned, on your website and the materials that you sent over to us, including the integrated line of credit. So tell us how that works. So somebody's got a big deductible, which is the movement these days, right, and they don't have funds in their account. Are you able to actually provide them basically a loan, a line of credit
Sure.
against that?
Absolutely. Yeah, that was built in our system when we originally launched our multi-purse program back in 2001. The thinking is, right, as high deductible health plans continue to be on the rise, more employers are trying to find ways to reduce their costs with health care for their employees. So they're offering high deductible health plans, and if an employee, typically they're offered a health savings account associated with that high deductible health plan, but that is funded over a course of payroll deductions. So it may take an employee several months or years to build up some value in that account. And in that time, if there is an unfortunate situation where an employee may have a catastrophic healthcare event, they may need some more funding. So in addition, the same piece of card, of plastic, can be used for a line of credit to be able to extend the value of that healthcare service and be able to help that employee make payments associated with some significant dollar amount that they have yet to be able to save for.
You know, that's such a critical area because people, say, well, gee, I can handle some payment of $20 copay.
Yeah.
And with a line of credit, they might be able to handle, the payment off of a loan over a period of time.
Right.
How do you qualify people for that card? Because I know in the normal, credit industry, the turndown rate's pretty high. So how do you handle that with the potential of bad debts? Or do you assume that the fact that they're working there with an employer, does the employer give some backup support for that potential bad debt?
Yeah, that's been part of the thinking, is that the employer may want to contribute some defined dollar amount to that fund on behalf of the employee. But really, from a financial institution perspective, they're underwriting that line of credit associated with that account.
Mm-hmm. So now I'm an employer, and I go this high deductible. I've got a $5,000 deductible, and I don't have employees with accounts built up at this point. Mm-hmm. How do I connect with your service? Do I come to you directly? Are you offering it through insurance carriers or TPAs? Or where are you in the stream of things?
Sure. So we work with several different entities. So we have relationships with many of the larger third-party administrators that administer FSA, HRA, HSA programs for employers. We also work closely with a number of health plans that offer these kinds of programs as well. And in addition, the financial institutions, that we have 4,000 relationships, and we have multitude of those that sponsor these programs.
So as an employer, again, let me push it a little bit further so as our audience is clear. If I want your services, I'm going to get that through one of my other vendors that I'm working with. How do I know which vendors would use your services and which ones don't?
Well, yes, the employer would have a relationship directly with TPA, a third-party administrator, and they would just check and make sure that they have all the different options and solutions and tool sets that they need for their employees as they go to make that decision. And they may not know who's behind it. First Aid has always been known as the business behind the business.
Right.
But the TPA certainly knows that we're here. And a lot of times they do bring us into meetings with their employer groups to help them explain our platform and the security of our platform and the vast, broad solution sets that we do bring.
Joan, where do you see the space moving, the healthcare payment space moving near term and into the near future?
Right. Yeah, I think that there's going to be lots of changes as we talked just now. The high-deductible health plans continue to be on the rise, which means more patient responsibility. There are surveys out there that indicate providers are currently unable to collect today 20 to anywhere from 20 to 50% of that patient responsibility amount. So as you pointed out, it's no longer just a $20 copay, right, but it could be a $2,000 bill that they're not able to collect. So being able to do some estimators at the time of the service, as well as being able to determine the patient's ability to pay that bill, those are tools through our provider merchant acquiring business, and also an asset we have in IntelliCheck, being able to determine a patient's ability to pay, to assist that provider up front and not having to worry about collecting afterwards. So there's all sorts of options from that perspective. First Data also offers we have many networks. We own the Star Network and many other merchant acquiring platforms that we can help bring a lot of different platforms that are out there from the payers, meaning the insurance companies and the providers, to assist them in that payment process and bringing some efficiencies and automation to passing payments back and forth. So there's a number of different things and solution sets. Wellness and incentive cards are also something that continue to get a lot of attention in this space, and we get a lot of interest from our clients on our abilities from a prepaid perspective to be able to offer solutions that to their employees that if you do certain things like take a health risk assessment. The employer might be willing to fund $200 into a prepaid card and allow you to use that for any purpose. But it's helping employees incent and make better health care decisions so that their wellness is taken care of as well.
So I didn't realize that was part of your solution set. So wellness incentive cards are part of your solution set as well.
Absolutely, yeah. That's been a big rise and increase in interest for our clients, and actually in the industry. There was a survey from Aon Hewitt. I think it said 64% of all employers today offer a wellness program, and a lot of those wellness dollars get put back onto payroll. But what we're seeing is that employees want a card where they can, once they achieve the task or whatever the event is, they can have the funds loaded, the $200 for the health risk assessment immediately to a reloadable prepaid card, and they can go out and spend that for anything they want as opposed to receiving pennies on a payroll.
Joan, the delivery systems are changing as well. How do your services fit into some of the changing, like doctors are moving to direct pay? Are you doing something in that space? Concierge services, those types of new delivery systems. How do your services fit in and accommodate those changes that might be going on?
Sure. So from a provider perspective, what we offer is just any way that the provider wants to receive payment. So we really deal in the payment aspect and providing tools for collection and billing services. So as a provider wants to accept payment, there's a new movement underway for virtual card payment. So it's a one-time use card where a provider is using their existing system to be able to receive payment, whether it's coming from the payer or whether it's coming from the consumer. So it's vital for providers to have multitude of options. The other thing from a payments perspective that seems to be changing is really mobile payments. Again, healthcare payments are you don't know what you owe until 30, 60 days later. Lots of confusion in the billing process. I get my EOB as a consumer. I may not really know exactly what I owe yet. Mobile payments really and digital wallets are a continual movement that is really big from healthcare because you're now away from the point of sale. Once you know what you owe, you can use your mobile wallet to make payment. And recently, you may have heard about the Apple announcement about Apple Pay, right? Well, First Data was selected by Apple to provide the tokenization of those transactions. So we ensure the security of those payments being made when you're using your Apple 6 phone.
Hey, Joan, we got about a minute to go, and I don't want you to be able to tell the audience how they can get in touch with you and leave them with a takeaway.
Sure. They can reach me through our firstdata.com website, and if they want more information. And a few things just to leave with your listeners is we are all about healthcare payments. We understand the complexity that occurs where there are many varied stakeholders that are involved in the revenue cycle management, and it's imperative to have that right payment at the right time and allow all the stakeholders in the ecosystem really a choice in how they receive payment. So that's really what First Data is working and striving towards.
Joan, listen, I really appreciate you taking the time to join us today. You have a great weekend.
Thank you. You too.
Take care. And to the rest of our audience, stay tuned for the next segment of Healthcare Consumerism Radio.